We are going to present on prescription drugs. My name is Jennifer Tran.
And I am Jessica Navarro. Prescription drugs are drugs that are not prescribed for you by the doctor or not recommended by a physician. Prescription drugs pose a severe risk of addiction and dependency that can lead to death. A drug that once freed you from pain might become the root cause if misusing the drug. Some of the reasons why people use prescription drug abuse is to get high, fitting in, escape, relax, experiment, to feel good or to get high, to reduce appetite, to be safe, meaning having the illusion that prescription drugs are safer than street drugs, to be legal, to feed the addiction. Prescription drugs is the third most commonly abused category of drugs, trailing behind alcohol and marijuana. The most commonly abused drugs include depressants, opioids, stimulants, and antidepressants. Tranquilizers are the central nervous system depressants, such as Valium, Xanax, and Librium. These prescription drugs are used to treat anxiety, panic attacks, and sleep disorders. Tranquilizers slow down the normal brain function to produce a drowsy and calming feeling. Opioids are the pain relievers of prescription drugs. They work by mimicking the body's natural pain relieving chemicals attaching to receptors in the brain to block the perception of pain. This is a highly addictive drug. It can slow one's breathing to dangerous levels, including accidentals. Stimulants increase alertness, attention, and energy. They enhance the effects of norepinephrine and dopamine in the brain. People prescribed with this prescription are those having such conditions such as attention deficit disorders, hyperactivity disorder, and depression, to say the few. Some of the drugs are stimulants. Some of the drugs are Ritalin, Adderall, and Dexedrine. The dangers of this drug include addiction, high body temperatures, seizures, and irregular heartbeat. Antidepressants are drugs used to treat major depressive disorders, including anxiety disorders, OCD, eating disorders, and chronic pain. Some of the side effects are delusion, slurred speech, and insomnia. Some of the statistics is that 2,000 teens begin abusing drugs each day. 70% ages from 12 to 17 obtain prescription drugs from friends or relatives. 2/3 of the teens abuse over-the-counter drugs before age 16. 20% high school students admitted to taking prescription drugs. Now, I'm going to turn it to Jennifer Tran to talk about risk factors.
People fear that they may become addicted to medications prescribed for medical conditions, such as painkillers prescribed after surgery. However, people who take potentially addictive drugs as prescribed don't often use them or become addicted. Some risk factors include past or present addictions to other substances, including tobacco and alcohol, family history of substance abuse problems, younger age, especially the teens and early 20s, certain pre-existing psychiatric conditions, exposure to peer pressure, or a social environment where there's drug abuse, and easier access to prescription drugs such as having prescription medications in the home medicine cabinet. Protective factors are not always the opposite of risk factors. Their impact also varies along the developmental process. Protective factors include strong family bonds, parental monitoring, parental involvement, success in school performance, pro-social institutions, and conventional norms about drug use, identify exploration in love, work, and worldview, making independent decisions, becoming financially independent, and balance of autonomy and relatedness to family. Abusing prescription drugs leads to social and personal consequences. Substance abuse leads young adults to alienate from their peers, disengage from school and community activities. In addition, young adults may result in family crisis and jeopardize many aspects of family life, sometimes resulting in family dysfunction. They also face financial losses and distress in finding employment, not able to become self-supporting, and leads to homelessness. Personal consequences include poor academic performance, including declining grades, absenteeism from school, and increased potential for dropping out of school. This can also lead to poor physical health, such as injuries due to accidents, physical disabilities and diseases, and effects of possible overdoses. These affect the brain in many ways. First, the brain does not fully develop until the age of 24. The brain is more sensitive to drugs during the age of 16. When abusing drugs, all the classes of drugs directly or indirectly cause a pleasurable increase in the amount of dopamine in the brain's reward pathway. Repeatedly seeking to experience that feeling can lead to addiction. Stimulants affect the brain by acting on the same neurotransmitter system as cocaine. Opioid pain relievers attach to the same cell receptors targeted by illegal opioids. Depressants produce sedating or calming effects in the same manner as GHB or Rufinol. And that concludes our presentation for